Well, now let's talk to Jane Townson then, who's Chief Executive of the Homecare Association, which represents care homes across the UK. Good evening to you, Jane.
Good evening. Can I just correct you? We represent providers of care in people's own homes, not care homes.
That's a helpful correction. Thank you very much. So Jane, in essence, the essence of the conversation is as it was. First, tell us how the petrol crisis has been affecting the services that your members operate.
So our members provide care and support to older and disabled people in their own homes across the country. Many of them are completely reliant on cars to do so because they have many miles to travel. It's not at all unusual to drive 100 miles on one shift of home care. And if people don't receive the care and support they need, they suffer and harm can come to them. The people that need support and care at home often are very frail. They have multiple long-term conditions. Many of them can't get out of bed by themselves, eat by themselves, drink by themselves, get to the bathroom. Some have quite high healthcare needs. They need peg feeds, they need stoma care, they need wound care, tasks which previously might have been done by district nurses but are being increasingly delegated to home care workers.
Yeah. So in the case of many of the people that your members help, a single missed visit, it could be all the difference, not just in the quality of life, but in the safety of the resident of that home who need help washing, feeding themselves, dressing, just avoiding coming to harm, some sort of accident in their own home. A missed visit could be all the difference.
Exactly. So this is not just an inconvenience for home care workers. This is a matter of life and death. And some of the people they're supporting are on end-of-life care. They need pain-relieving medication at particular times. And it's just so difficult. And this comes on top of other difficulties that they've experienced. We're currently going through the worst shortage of home care workers in history. We've just been through a pandemic. Many home care workers were the only ones seeing people face-to-face. Other health professionals, the national policy was for them to work remotely as far as possible. So home care workers provided a lifeline to many people. And right at the beginning of the pandemic, you'll recall, they didn't even have adequate PPE because the PPE supplies were diverted to the NHS. So they were left making their own masks, turning bin bags into aprons. And all the way through, they've been neglected, even in relation to care homes. So they're remarkable people that do home care. They love it because they know that they're making a real difference to people's lives, and the relationships that build up between them and the people they support are really heartwarming. But it really hurts them not to be able to visit on time.
And Jane, has that been happening? We're 5 days into this crisis, and we would all hope the Prime Minister is right when he says the problem may be beginning to subside, without any great intervention on the part of government. But has there been an effect so far that you've seen on visits by your care visitors to the people they help?
Oh, yeah, absolutely huge, because people have been late. I think mostly they've managed to get there in the end, but it's just created a huge amount of stress. And for the Prime Minister to stand there and say, oh, well, we'll just let it all happen is frankly disgraceful. 5 days ago, we should have had a plan and put it into place to make it possible for essential workers like home care workers to carry on their business. And because government will not accept that there is an issue, that has meant that local resilience forums haven't been able to invoke their civil contingency plans, which would provide support to care workers. And some of the solutions are quite easy, just making a pump available at a designated time, giving vouchers to essential workers so that the fuel retail staff know who is eligible.
Yes.
These are not difficult things, but the government has just been a wall of silence and left everyone to get on and fend for themselves yet again. And it's really disappointing that they set so little store on the health and well-being of older and disabled people.
I can hear the anger in your voice, Jane, as you describe your view of the way things have been developing. And you say that action could have been taken days ago. There is a view. I was talking earlier on to the former head of the civil service, Sir Bob Kerslake, who thought action could have been taken weeks ago, many weeks ago, because some of these problems they were foreseen.
Yes, exactly.
Yeah, and so now your message to the government is what? First of all, forget about not intervening. If things go on as they are, you'll need to intervene quickly. I guess that's your first point.
Well, we just need to make it easier for people who are trying to perform essential roles to make life better for people in our society. It's not difficult. There's just playing politics with people's lives. And I don't know when the general public is going to wake up to this, because what people will remember when it comes to a general election is how the government's response made them feel, not what whoever was, not the whys and wherefores of why it happened. And so I think the government needs to be very careful, because a lot of older people are voters as well. And I think patience is running out with this kind of attitude to social care.
Jane, thank you. Jane Townson there, who's Chief Executive of the Homecare Association, which represents care visitors to people in their own homes across the country.